Good afternoon. Welcome to City and State's latest legislative forum on the biggest issues affecting seniors. Today, we're out in Queens with a great group of legislators and one very vocal advocate to discuss all the latest. I'm Zach Williams, Senior State Politics Reporter at City and State. Super excited for this event, which we could not have gotten done without the help of our great sponsor, AARP New York. So much is going on nowadays. The state budget just passed a few weeks ago with all sorts of provisions affecting older folks. And there are just a few more weeks to go before the state Senate and Assembly adjourn for the summer. And then there is the coronavirus, which is still lurking in plain sight as the economic reopening process really begins to pick up steam. So let's get started. I'm going to introduce each of our panelists. Please just give a little wave to the audience so we know who we're talking about. First up, we got State Senator Joseph Addabbo Jr. of the 15th District, State Senator Leroy Comrie of the 14th District, State Senator John Liu of the 11th District, Assemblymember Catalina Cruz of the 39th District, State Senator Jessica Ramos of the 13th District, Assemblymember Brian Barnwell of the 30th District, Assemblymember Jennifer Raj Kumar of District 38. And we also got Kevin Jones, Associate State Director of Advocacy at AARP New York. And hopefully in a little bit, Assemblymember Jeffrion Aubry of District 35 will be able to give us a little bit of time by jumping off the floor where I believe he's currently presiding over the Assembly session. So let's jump right into it. So many issues to cover, but I think one that's really popped up in a lot of these forums is broadband. You know, an issue that affects seniors, affects everybody. We've spent a good part of the last year at home, and a lot of people are having trouble staying connected. So, you know, the state budget included a few really important provisions when it came to broadband. Maybe we could start the conversation. One of our great legislators could explain a little bit about what was in the state budget and how it affects broadband access for seniors.
I'll jump in, Zach. First of all, let me note that you cleaned up pretty well. Finally got rid of your COVID hairstyle, and you look good. I think, and Jessica's like pretending she's shocked at what I'm saying. Anyway, the state budget did do a lot of things. I'm very proud that we fought very hard for education funding, specifically foundation aid, finally putting together a 3-year commitment to fully funding this 15-year-old court mandate. And you know, we had to fight the governor for many years, but we got it done this year. And it's thanks to not only the efforts of the state legislature, but also the advocates out there. And part of that education package has been expanding broadband access throughout the state. In New York City, where there are still places where Wi-Fi is very weak, as well as more rural parts of the state where the infrastructure hasn't even been built out yet. So there is a commitment to funding broadband, and much of it will rely on the internet service providers to build out their networks, as well as boost the signals themselves. Now, let's face it, these internet companies have made money hand over fist during this past year, where people relied on the internet more than ever before. And so they can afford to reinvest some of that money into the communities that they made so much money from.
Well, Queens is in the middle of a city. How is it in the 21st century? People are still having trouble. Obviously, there must be, the fiber optics must be somewhere in the ground. What has been so difficult to connect seniors, and what was in the budget that will specifically address that?
Well, I'll tackle part of it, but it's not a complete answer because everything's not done yet. There's still areas of Queens that don't have high-speed broadband access. There's still areas in my district because the companies, unfortunately, their contracts allow them to wire up the areas that they felt were most lucrative first. So there's parts of all of our districts where we have constituents that need broadband access that can't get it. So there's a real issue with the city when they do the next set of contracts for broadband opportunities or wireless contracts with these providers to ensure that the coverage throughout the entire city is done. There's some issues of exclusivity where you can only get one provider, and some of those providers are definitely not providing access to communities. And so we have a series of other bills on broadband where we want to try to make sure that anyone that's at a certain income can get access to higher speed broadband, and what the governor has actually proposed, because the governor's proposal that he put out really doesn't cover high enough broadband access for people to utilize, especially if you have a need to access more than one device in a home for any significant period of time. So we still have some work to do on broadband, but we're just getting started.
Well, I hear you there. Obviously, broadband was a big part of the budget.
Broadband was a big part of the budget, and but again, we weren't able to get all the way there to the point where we can make sure that all of the seniors were covered. They did. Again, the governor at the last minute put in this compromise proposal that none of us were satisfied with, but because we were up against the clock, it was the best we could do at the time. But this legislative session has been a little difficult because of the pandemic, but we did some other major things for seniors, such as canceling the tax lien sale, increasing SCREED, increasing the senior citizens homeowner program, doing more for various housing assistance programs. We also work to make sure that we expand senior housing opportunities, and we're working on bills to do opportunities to create medication, deal with a bill that would create a drug guide for all medications that are regularly used by seniors. And then, we got to still deal with senior homelessness in the area, which is expanding because of the issues of many people in Queens are moving, and that a lot of the seniors that were living in homes are winding up having to find other places, and they can't afford the rent. So we still have a lot to do on issues for seniors, and I look forward to working with my colleagues in the Senate to get those things done.
Now, Senator Comrie has opened our conversation so much. He really threw out some great topics there. Who could maybe jump in and explain a little bit about how one provision that he just mentioned affects your constituents?
Listen, it's a big budget, a $212 billion budget, and certainly our most vulnerable, certainly over the population is seniors. And it's great work with my colleagues. It's again good to see them all, and I want to thank ARP for co-sponsoring this, as well as city and state. Many of our phone calls, certainly I'm sure, come from our seniors in terms of their concern, even post-COVID, but during the pandemic. My friend Leroy has brought up many, but a lot of my seniors are concerned with transportation as well. As they get to and from a doctor's appointment, or again, travel as they start to get out. We have to make sure that the money that we did spend, for in the budget for the MTA, bus, train, else, the bottom line is public transportation is so important for our seniors. And I think as, the MTA comes back to a full schedule, eventually post-pandemic, the idea is to make sure that that schedule, that service is credible and reliable for our seniors. Food availability. Many of my seniors during the pandemic were certainly in need of food availability, as they were concerned and homebound. So, when we sought to fund, certain programs like Nourish New York, $25 million in budget or so for Nourish New York. These programs are so important for our seniors to make sure that the basic need of food is received by them. And again, not only just during the pandemic, but we have obviously issues regarding food availability even going forward post-pandemic.
One big provision in the budget that I would have to imagine has a big impact on Queens, the most diverse county in the entire country, is this Excluded Workers Fund that we've heard about, as well as housing relief. How is this playing out in Queens? Or is it a matter of educating people of how to access it, or are there other issues? Who wants to explain a little bit about how that is affecting seniors?
Well, I'm happy to talk about the Excluded Workers Fund. It is my baby. The Excluded Workers Fund, as many people know, is for people who were excluded from any of the wage replacement programs that are offered at the federal level. So unemployment insurance, pandemic unemployment assistance program, the stimulus checks, people who fell through those cracks and still are able to provide proof of loss of income should be eligible for some economic relief for work lost during the peak of the pandemic. And so we've been working very closely now since the budget passed with the Department of Labor to make sure that we are implementing the program and launching the program in a way that honors language access, which of course, you know, is a huge issue in many of our communities, particularly in Queens, and to make sure that we are promulgating an actual point system for the second tier, which is something that we left out of the way the law is written within the budget, to make sure that people are able to start gathering their documentation and they are ready for when the program actually launches. And we have, I do want to caution, we have heard of some scammers who are trying to, quote unquote, help people apply for this fund. The fund has not been implemented. It doesn't exist yet, but we are working with the Department of Labor to make sure that this happens, hopefully by the end of the summer. And that's something, of course, that I'll be watching very diligently. I did want to throw out one other senior issue that is perhaps very specific to my district, and I know Senator Comrie's district, and that's the fact that we represent the largest number of TLC licensees in New York City. And these are folks who on average around the age of 57 and are certainly looking towards retirement, which is not something that is afforded to our taxi drivers, unfortunately. And of course, there's the Medallion Crisis, something that I've been focusing a lot of my time on, because I feel that a lot of these taxi drivers were duped by the city of New York and deserve some debt forgiveness in order to avoid foreclosures, avoid bankruptcies, or worse, unfortunately.
Now, not everything about being a state legislator is legislating per se. Constituent services is a big thing as well, especially in a year just like this. And I know a lot of you have been very active over the past year during the pandemic. Assemblymember Cruz, you're someone that comes to mind. I know you were very involved in helping your constituents access food. What's kind of the current situation with food insecurity, with seniors in particular, in your district?
Well, it's gotten a little better. There are no, let me rephrase that. It's gotten better because we're no longer seeing the lines, but not necessarily because the need is not there. And so are folks going elsewhere, or is it because we no longer have certain food pantries that are as active as before? Only time will tell. I will say, going back to what Senator Addabbo said, the $50 million for Nourish New York, it has been one of, I think, our community's biggest blessings this time around. You know, it's going to help fund food pantries that helped keep our community literally alive during the pandemic. And we look forward to it becoming, so I hope that every senator who's on the call is going to be signing on, because I know the assembly members are going to help us pass it on our house, and I'm going to need your support so that it can become a permanent program. We have the money, now we want to make it permanent so that it's happening every year. We are seeing that while food insecurity is not the issue that's in our face anymore, the access to vaccinations is. For a long time, we didn't have that. Even when seniors in our community were being given priority, when all you can find is an appointment at 2 o'clock or 3 o'clock in the morning, and in some of these more far off locations that are not near your home, or you live in a transportation desert, as a senior, that's not real access. And so, you know, I was hearing stories of some of our neighbors having to travel all the way from Corona, which happened to be one of the locations with the highest number of deaths and the highest number of people infected, yet one of the lowest numbers of the vaccination rates. And so we had seniors going all the way from Corona, going out to Jamaica, going out to Brooklyn, because that's the only place where they could find an appointment at a time that worked for them. We worked closely, and Assemblymember Aubry will jump on the call later, but we worked closely with him and with my colleague Jessica Gonzalez Rojas to push the governor and to push the mayor to prioritize Corona a little more. I got to say, the governor, for whatever it's worth, actually was very responsive to this issue. And we've had several pop-ups in our district. I wish there were more permanent sites, but this is something. The mayor has been a little slower to respond. He has hosted a couple of pop-ups as well. But I think if you look at the numbers of before we had these events and post, there's been an increase. Still not enough, but it is a significant increase of folks who are vaccinated, and a lot of them are seniors.
Yeah, we've kind of reached it almost seems like the vaccine distribution process is starting to level out a little bit. You know, there was so much excitement, everyone had to wait, scramble for appointments, and now it's more of finding the people that are either hesitant for one reason or another, or don't have access. Now I'm gonna pick on Assemblymember Barnwell right now, just because in the Q&A somebody said, quote, his office does a superb job in providing outstanding services to constituents. Maybe you've seen a thing or two about the real issues that seniors in particular are facing to get vaccinated.
Sure. Well, obviously not just about vaccination, but that was certainly one that's still a problem. You know, a lot of seniors, called our office, and we helped them obviously navigate the online system and the phone system. But, you know, if you couldn't get through on the phone, which was what you were seeing early on, they didn't have an option. It goes back to honestly your first point about broadband access, right? But they couldn't even get through online. They didn't have it. They couldn't do it. They didn't have online access. So that was a big problem. And kind of like the unemployment thing, no one can get through on the phone. So I don't like to throw bombs, but obviously the rollout for everything during the pandemic could have been a lot better, obviously, with the governor's office. But I also kind of want to circle back real quick to. I know Senator Addabbo and I work, have similar issues in our districts, but, property taxes, talking about seniors here, right? Property taxes, and people are moving out because they can't afford the property taxes. I have legislation out there that would make the property taxes, you get basically a property tax break based on your age. As you increase in age, you have less income, I would assume, right? Because you saved all that money, and now it's by the time you get to the more you move up in age, the less money you have saved. So we need to look at solutions that are going to be, progressive based, we'll even call it, where you have less money as you age, you should have lower property taxes. Again, there has not been a focus, in my opinion, of the administration to help seniors as much as they can, and whether it be property taxes, whether it be vaccines, whether it be even unemployment to a degree, we have to have better resources directed towards seniors. Like another thing I know kind of rolled out a little bit later is having people go to the seniors' homes who can't leave their homes to get vaccinated. Why was that program not initiated in the beginning of the pandemic rollout? So we definitely faced a lot of those issues. I would say for the first month, I think we're finally getting over that point, but for the first month, seniors could not get through. They couldn't get appointments. I was up at 3 a.m. trying to, prepare for the next day of seniors to call and try to get outreach. We did outreach to about 1,000 seniors in the district, proactively calling them to try to get them appointments. And, so many people needed our help. And, again, if you don't have online and you can't get through to the phones, what do you do?
Someone was bringing up language access a little bit ago.
Sorry,
yeah. If I remember the campaign correctly, Assemblymember Raj Kumar, who got elected for the first time, did a few things to increase language access for her future constituents. Have you seen much progress on that, as the months have gone by, and what do you think is still needed and where in terms of connecting seniors to the services they need in the language they actually use?
Thank you for the question, Zach. It's great to be here with you and with my colleagues. Thank you to AARP. So absolutely, to echo what my colleagues have said, what I've seen on the ground is that a lot of seniors didn't have access to computers. So they had trouble booking their appointments. So seniors would actually come to my office, and we opened up my office for them to book appointments. And I was so proud of my entire staff and team for the appointments that we were able to book for hundreds of constituents. And that includes people with language needs. So we were able to book vaccinations for people who are from the Punjabi community or who only spoke Bengali, or of course Spanish. One thing that I would like to highlight, you asked about current gaps and needs, is that even as our population is getting vaccinated, there are still people coming down with COVID. And so one bill that I have introduced that over 20 of my colleagues have now co-sponsored, which I'm very grateful for, is a bill that will make the monoclonal antibody widely accessible. Now, to jog everyone's memory, when Trump got COVID, he was infused with the monoclonal antibody cocktail. And studies have shown that if you get this cocktail, this antibody cocktail, within 7 days of a positive test, it decreases the risk of death or complications by 70%. So this is literally a life-saving drug. And if it's administered to high-risk COVID patients, it could save lives. So I think that the New York Times and NPR and other sources have written about this drug. It is free. It doesn't cost anything. But only 20% of it has been used by hospitals. The rest of it is just sitting there. So one of my top priorities will be to get this bill through, because I really believe that it can save a lot of lives as we are on our way to vaccination. Also, it's very interesting what was said here about the Excluded Workers Fund, because it was great to see the effect of it on the ground. As soon as we passed the budget, my office immediately began getting calls from undocumented people in the district who said, hey, I'm very interested in this. How do I get access to the funds? My chief of staff was on the street and someone called out to her and said, hi, you work for the Assemblywoman. Can you tell me how I can get access to these funds? So it's great to see that the word has gotten out about what we have done in Albany. Every week, we have a food drive in front of my office. And even as late as last week, hundreds of people line up for food. So food insecurity is real. It's still present. And I'm so glad that the 50 million to Nourish New York was included in the budget. I think that that's a huge, huge plus. So those are some of the issues that I'm seeing on the ground and some of the gaps that I think we need to fill.
And that's the perfect segue to looking ahead. There's what, four weeks left in the legislative session. It's really hard to believe it's gone by so fast. And seniors are a diverse community unto themselves. There's a big difference between a 60-year-old and a 90-year-old and a 75-year-old. Kevin, your organization represents all sorts, right? Everyone, I believe, 55 plus. What are you hearing from the members, and what are you looking, to get done before state lawmakers head home for the summer in June?
Sure, no, that's a great point. First, I want to thank everyone for being here. We really appreciate everyone's participation. We know it's a really busy time, the post-budget sprint to the end of session. But there are a couple of items that are very high on our priority list for the remainder of the legislative session. And as Zach just mentioned, we actually represent the 50 plus. So we have a lot of interest, obviously, in things that help seniors, but there are a lot of folks that are still in the workforce that are AARP members as well. So one bill I want to mention is the secure choice legislation, which is Diane Savino's bill at Senate 5395. Certainly hope everyone on this call or on this panel will sign on to that. I believe the assembly version by Assemblymember Rodriguez was just passed today. Basically, this will update the 2018 Secure Choice Savings Program Act, which was passed to create a state facilitated IRA program that allows that basically people that don't have access to retirement savings through work, this creates that system for them. Now, this was an opt-in instead of an opt-out in the original version. The bill that's currently being considered right now, the Savino bill, would actually require any business with 10 or more employees to participate and automatically enrolls the employees in. And one of the reasons that's so important is because people are 15 times more likely to actually participate in a retirement savings program if they're automatically enrolled. So the other thing is that this would allow folks to carry this with them from job to job. So it's portable with them as well. And you know, as I think everyone on this panel knows very well, you know, this is going to be crucial for folks that are retiring, because Social Security income is not enough to retire in New York City. The cost of living here is just entirely too high for that. So this is going to be very important for that. One of the other issues that we're pushing very hard right now is on accessory dwelling units. So these are secondary homes located on the same property of a primary dwelling, sometimes called mother-in-law apartments or granny pods. They increase affordable housing, they're convenient living arrangements for family caregivers and their loved ones, and they allow older adults to age in their own communities, which is basically what the vast majority of older New Yorkers want. The Senate bill is by Senator Harckham, 4547. Assemblymember Epstein is 4854, has the companion bill. So this bill basically requires municipalities to allow these structures and establish standards for ADUs, which can be just have a great impact in terms of folks that want to stay in their community, but also providing additional affordable housing options. And I just want to mention one more, as I got everyone's attention for a second, I just want to one more bill, which is what we call the pay for delay bill. Senator Biaggi has a bill 4370 that would basically outlaw deals between drug manufacturers that produce non-generic drugs when they make deals with those manufacturers that produce generic drugs that delay generic drug options coming onto the marketplace. So this basically keeps the cost of prescription drugs much higher, not just for seniors, but for anyone, 50 plus or anyone that needs access to affordable prescriptions. So these are three of our top priorities that we hope everyone on this panel will be able to sign on to and help us get across the finish line before the end of session.
So polite. Jump right in, senators.
I don't want to disrupt anything here, Zach. I want to thank Kevin for outlining those top three priorities. Very, very commendable. You hit income security, housing security, and medical security in some fashion, the prescription drugs. Those are bills that are, I just looked at them. They're pretty good bills, and I will sign on to them. These are just a number of some of the bills that we should pass in the remainder of this legislative session to really protect our seniors as we come out of this long, dark COVID tunnel. So thanks very much for pointing those out. And Kevin, thanks to you and AARP as well for sending me that monthly solicitation. I'm not sure if I totally appreciate it, but every 15th of the month, I get the invitation to join, and I tell you, you really up the ante, because it used to just be that free tote bag. Now you're offering a free trunk organizer.
We're gonna get you as a member, Senator. So
yeah, we'll see. Thank you.
I intend to sign on to all three bills as well. That they're common sense bills that provide needed relief for our seniors. So I want to thank AARP for mentioning them, and I want to also just echo what Senator Rajkumar has said about food insecurity and the need for seniors to access vaccinations. All of our offices were working hard to try to make sure that we could do what we could to get so many seniors registered. So we had, during the height of the pandemic, we had a volunteer corps that we shifted from direct food delivery once the food vendors stopped, to just making sure that we got seniors access for appointments and access for Department of Labor information and access to getting their taxes done, because a lot of seniors are not computer literal or have laptops or computers in their home. So that's a real issue that we have to address also. So I want to just thank all of the volunteers that have helped all of us, because they've stepped up to make those calls as well. And we're still looking for volunteers because the issue of food insecurity is still very high within our communities. Thank you.
So I
Senator
want
Ramos,
to correct
you
one
want to
thing
jump in?
before when I said that employees were 15 times more likely. It's actually 20 times. So I apologize. I kind of undersold my own statistic. But yeah, so for the secure retirement program, employees are 20 times more likely to participate in a program if they're automatically enrolled. Sorry, Zach, I didn't mean to interrupt you.
No worries. I recall Senator Ramos wanted to jump in a little bit ago. Did you have something to say?
I did, thanks. I wanted to plug in the New York Health Act, which I believe would help many seniors. I'm the prime co-sponsor in the Senate, and we've been really pushing to make the case for one unified single payer healthcare system, of course, at the national level, which would be ideal. But in the meantime, trying to achieve this at the state level so that every single senior and every single New Yorker, because as we learned during the pandemic, it matters who's sitting next to that senior citizen on the bus and whether that person is coughing or not as well. We want everybody to be able to access guaranteed high quality healthcare, including vision and dental, which is very important for our seniors, of course. So I wanted to plug in the New York Health Act, and hopefully that comes to fruition very soon.
I'm actually not sure off the top of my head. Does the AARP have a position on single payer healthcare?
We don't have a position on that bill at the moment, but we are reviewing it.
Well, I encourage you to come join the cause. Happy to talk offline.
Great. No,
Ramos will give you a free tote bag.
I don't know about tote bags, but I'll give you free facts.
One audience member in our Q&A has jumped in, mentioned another kind of hot button issue, elder parole, which obviously affects seniors, and Queens is a big place. I imagine there's quite a few incarcerated people from there. Where do things stand on that bill right now? And just how do you see it? How do you see the local connection playing out? How much of an impact might it really have among your constituents?
Okay, well, you want to go ahead? All right.
I'll just say that I think this is an issue that we should look at, because somebody who has spent years and in many cases decades in prison already, but they're now in their senior years, they're no longer a threat to society. They have certainly learned their lesson, and let's live out their lives in dignity. There's no need to imprison these people until their death if they haven't received life sentences.
I mean, for me, this conversation is of course part of a much bigger conversation about decarceral policy. I'm a big proponent of elder parole and clemency, which I would add, Governor Cuomo is not someone who has been a big proponent of clemency and finding it in his heart to let many of our eldest who perhaps made mistakes when they were a lot younger and can age with grace, with their families, has not taken action like we would like him to. And the same thing goes for elder parole. I mean, I'm a supporter of the bill. I believe Senator Salazar, who chairs the relevant committee, has also been pushing very hard for this because we want to have fewer people in jail, especially those who don't belong in jail, who are no longer a threat to society and have certainly paid the bulk of their debt to society. So this is something that we should not only consider, but something that we should get done relatively soon and would save the state a lot of money.
Yes, I'm a supporter of the bill also, and I just want to ditto everything that Senator Ramos has said. It's important that we try to move this bill out this session. We've been having some challenges with getting the second floor, the governor's office, to approved the bill, and and we need to try to make sure that both houses pass this bill before the end of the legislative session. I was honored to pass a bill that had been stuck in the without a Democratic majority for many years recently, which was a voting rights bill for parolees that make sure that they could get their voting rights restored as soon as they come out. And we're still trying to get the halt solidarity bill passed as well. Hopefully we can move that out this session. So, and there are a lot of things in the criminal justice and area that we need to try to address. And hopefully we can get to as many of them as possible during this session.
So I would like to point out to our audience members that if you would like to ask a question of the legislators, just do it in the Q&A function, which if your screen's anything like mine is probably towards the bottom somewhere. And somebody actually came in with a question, and I have no idea what they're talking about, but it looks awfully important. Was the regulation regarding a look-back period for Medicaid home care implemented on April 1st, 2021? Can anyone help me out? I'm not quite sure what exactly is going on there. The Medicaid home care look back period. Well, fair enough. I'm gonna look it up myself after the event, and I'll try tweeting about it. The audience member can follow up on that, and we'll see what's up. You know, some that has come up a lot in these forums, and we've done several across the state, is just quality of life. You know, seniors, like anybody else, and again, very diverse, very different needs, you know, want to have a good life, and a lot of them have been stuck at home. You know, some that has come up is senior centers being closed. So who can tell me, you know, whether it's dealing with senior centers or anything else, access to transportation, I think came up earlier. How can we boost the quality of life for seniors out in Queens?
Well,
I think there was oh, I'm sorry, go ahead.
No, go ahead, Assembly Member.
I think we're having the conversation about access to the internet, but we're not having the conversation about the kind of investment we have to make on actually creating literacy around technology and how to use it, and the actual computers. For many seniors, it's just not something they can access. We have families in my district who can afford the computer but cannot afford the internet because it's an ongoing cost, or vice versa. We have seniors who are on the same who are facing the same issues. And so when we don't have our senior centers open and they don't have access to the internet and they don't have access to friends, and the isolation and what that means for their mental health and what that means for their physical health, it's a wider conversation about how do we help them age with dignity. And so if we're not going to open up our senior centers anytime soon, or we're not going to make sure that all of them are vaccinated so that we can take that step and we can reintegrate them, then what are we going to do? Are we going to be investing to give them computers, to give them tablets in the same way that we did with the children in our community? They deserve that same respect. In the assembly, we invested 15, maybe it was $10 million into creating this knowledge around technology, but it wasn't necessarily targeting seniors. And I think we, as a joint body, if you will, need to be looking at that piece of this conversation as well. We can't just say we're going to provide more access to broadband if the person can't afford the computer. What are we going to do?
Yeah, I just want to add one thing to what the assembly member said, because she made a really good point about isolation. And one thing that we know about isolation is that it can cause the same amount of damage to your physical health as smoking 15 cigarettes a day. And that's a really serious problem when we have so many folks that are so disconnected, not just because they don't have broadband, but as she pointed out, don't have the devices that would connect them. I know that some of the folks that received these from the city early in the pandemic actually gave their devices to their grandkids or to other kids in their family because they needed to do remote learning. And that was a really unfortunate position for folks to be in. I mean, I know everyone was in a rush trying to get services and things to folks, but now is the time, as she points out, to really look at what it means to build out capacity for, you know, God forbid, us having to be remote for this long again.
One audience member is asking about the crime situation in New York City and how we can particularly help seniors avoid you know, avoid crime. Any thoughts on how to help that population in particular?
No, but I do find it interesting that the city has figured out how to create a buddy system for city workers to get to work. And perhaps the same should be considered for our elders to get around. Also, I think the fact that senior centers remain closed to be pretty outrageous. I mean, these are places that I think could even be serving as vaccine hubs, so that more of our seniors, if not all of our seniors, are left with no excuse but to get their vaccine and be able to, certainly improve their social life, right, and be able to share and partake with their peers. I think that's really important. And I did want to go back a little bit to the home care situation, because even though I would like to understand what the audience member means in terms of the look back period. There is an issue with home care where both the senior citizens receiving the care, and sometimes many of the home care attendants are seniors themselves, or certainly particularly women over the age of 55. Sometimes they're 1199 members, sometimes they don't have a union, but they're being forced to work 24-hour shifts while only being paid for 13 hours. And this is backbreaking work that certainly has diminished their quality of life with their own families, their health outcomes in general. And I just believe it's quite outrageous and probably indentured servitude that this industry is forcing so many home health aides to be working 24 hours, a 24-hour shift. So I do want to shout out our colleague from Brooklyn, State Senator Roxanne Prasad, who has a bill that would place a limit on the maximum amount of hours that these aides would be required to work in order to protect them. And again, many of them are older themselves. But we do want to, of course, then by doing this, also improve the quality of care that our seniors are receiving at home.
Well, that's a pretty good segue to a huge issue that came before the legislature this year, long-term care reform. Obviously, the COVID-19 took a huge toll on nursing homes. Could somebody just explain, where things stand with nursing home reforms, what's passed, what needs to still get done perhaps in the remaining weeks of the session?
I'll take a first crack at it. I mean, there were just recently, we passed a whole package of bills looking to reform how nursing homes operate. And I'll be the first to admit, I don't remember every single one of the provisions, but they do range from requiring nursing homes to provide information on their websites to making sure that a certain proportion of their revenues go to actual direct care for the residents, as opposed to indirect and care that the family members would not necessarily consider actual care, to allowing family members to visit, which has been a huge crisis for senior citizens. They have not been able to receive any visitors for such a long time, and unfortunately, such a large number of them have died without their loved ones at their side. So a whole host of a whole host of bills that seek to improve the quality of life of nursing homes. And there's also an ongoing struggle with how the state should treat nursing homes, whether they be for-profit nursing homes versus nonprofit nursing homes. We want to make sure that there is some kind of capacity for nursing homes to not only be created, but also expand their services. But at the same time, we need to make sure that the monitoring and the quality check on these nursing homes are robust. Not the for-profit nursing homes will always claim that, the regulations we're trying to foist upon them will drive them out of business and not going to be able to take care of our loved ones, our family members. But on the other hand, we do need to ensure that there is this quality and transparency Lack of transparency was clearly a big problem with nursing homes this past year.
I just want to echo that, and I think Senator Lou covered pretty much everything, other than the safe staffing requirement. There was an issue where we passed a bill to make sure that there was a minimum of 3.5 hours out of a 24-hour day that they would, nursing homes would make sure that their residents were attended to by an attendant with 3.5 hours. And even that number is low, but we wanted to, it was the best we could do after a lot of discussion back and forth with nursing homes, because one of the issues that they brought up was that the reimbursement for their workers are not the same as hospitals. So we have to work on trying to fix that as well. They're losing a lot of nurses to hospitals because their rate of reimbursement is higher. The number of people that are trying to be nurses has diminished as well. And we have to work to try to get more nurses in the pipeline throughout the state, throughout the country. Those are some of the issues that we're working on. But the nursing home issues that have happened, as you know, there are many investigations that are happening still regarding it, and we want to see full investigations, because there were some real tragedies that happened in the nursing homes, and the lack of transparency is still bills that we are still writing to try to make sure that there's increased transparency for quality of care within the nursing home environment. But we did a lot. I think it was 9 bills that we passed, 6 or 9 bills that we just passed last week dealing with various nursing home issues.
And I think, just to add to my two friends, my two colleagues here, is the fact that the dialogue and the deliberations that ensued with these bills were not seen as punitive. This is not an attack on nursing homes, but this was to identify those who are not doing the right thing by their patients, by those loved ones who needed the services of the nursing homes, but that basically were to improve those nursing homes that were not doing the right thing. And I think that's a good target for us to have, not to throw the baby out with the bathwater and hurt those nursing homes that were doing the right thing during the pandemic, but that we were really, in a very methodical way, identifying those nursing homes that were not really up to standards that they should have been, in taking care of those who were in need.
Yeah, and I just want to add that I from AARP's perspective, we think there were obviously a lot of problems, especially at the beginning of the pandemic. We want to thank everyone that worked so hard to move forward on a lot of these issues in terms of better transparency, better visitation, better discharge policies. But we also want to make sure people understand that we think we still need a better modernized long-term care ombudsman program, for example. We're glad to have a staffing minimum in law. That's a good first step. We still think it should be a little higher. So I mean, I'm probably just kind of echoing what Senator Comrie said, but I do want to recognize that there were some really great steps and important steps taken, and we just hope that this can continue to move forward.
Senator Ramos, did you have something that you wanted to add?
Oh, it was pretty much covered, but I mean, I wanted to make sure that, in talking about nursing homes, we mentioned the fact that there was gross negligence happening, out of the Cuomo administration at the peak of the pandemic, and that it does merit a thorough investigation, and that investigation should be swift. We are now past the year mark of this pandemic, and Andrew Cuomo is yet to be held accountable for the death of those folks and the disappearing of the data or the manipulation of the data. And Melissa DeRosa and nobody else from the administration has had to answer to this. So, hopefully the Assembly starts taking action soon. So that we can get to the bottom of this and hopefully give those families the peace of mind and the justice that they deserve.
And since the impeachment was mentioned, and we do have a few members of the Assembly here, just any quick thoughts on where things stand on that, especially in regards to nursing homes?
As the one member who's sitting on the Judiciary Committee, I am going to say we're going through the process. Oh, I think you're on it too with me, Jennifer, right?
Yes, I'm also on that committee.
Yep.
So,
we are going through the process.
yes, due process is very important, and I'm confident in our committee and its members to do the task at hand before us.
And we can't wait for you to send us that big eye.
We ready? We're ready.
Uh-oh, I don't want to get him in too much trouble though. So we'll just leave that part at that. What, we're almost running out of time, but one quick issue I did want to get to was medical costs. It was bad enough before the pandemic, and now so many people for one reason or another have incurred costs. Some that actually came up in our Monroe County forum was a bill, the Patient Medical Debt Protection Act, a packet of bills that would better protect consumers from medical billing abuses. Does anyone have any thoughts of where that stands right now, or how we might otherwise address medical costs for seniors?
I want to jump in just real quick about billing. There's been a bill in the Assembly and Senate for a while. I carry it now that basically says you cannot be billed until you approve the charge. Like, the insurance company needs to tell you what they're actually going to charge you for. And then the doctor has to say, hey, I'm going to do A, B, and C. This is what it's going to be charged for. You have to accept it. If you don't accept it, you don't get the procedure, but you don't get billed. And, until we have more truth, you're not going to have anything change like that. So that bill is obviously very important. I know it's on the calendar, but I think you get to stop before it even gets to that point. Not after the fact. Billing after the fact, then you have possible litigation, and people get scared and they just pay it right away. That's a problem. But stop it before it starts. Tell them what you're billing them for.
All right. So here, let's see, we got 9 minutes.
Support that bill as well.
Oh, we just got about 9 minutes. This is the part that I call the legislator challenge. Nobody likes talking to legislators more than me, of course, but like journalists, sometimes legislators have a little bit of trouble with brevity. But I do want to give each of you a chance to highlight one last legislative effort, a bill, or anything else that you want to get done before the end of session. But we're going to have to move quick to have time for all of you. So maybe if we start with State Senator Ramos, who's stepping forward, maybe you could take about 30 seconds, a minute to explain what you would like to get done.
Thank you. As many people know, undocumented workers, especially older ones, don't necessarily have access to a pension or a retirement fund. And so wage theft is an increasingly important issue for those older undocumented people who are working particularly in the construction industry. And so I have a construction wage theft bill that would help them clarify and provide, make the general contractor have full liability so that it is easier for us to chase the money that the worker has already earned. So that, coupled with the sweat bill, we can help many of our undocumented seniors who are still working, unfortunately, unable to retire, actually access the money that they have earned. So that would be very important for me. And if my colleagues would sign on, if they're not already, I would appreciate that.
State Senator Ramos has passed the test. Next up, let's Assemblymember Raj Kumar. What is one bill or a bill or two that you would like to get done before the end of session?
I would like to see the monoclonal antibody bill become law. I call it the early COVID-19 Intervention Act, to save lives while we can. Also, I think we should explore bold reimaginings of our healthcare system at the end of session. I'm a proud co-sponsor of the New York Health Act. I think that prescription drugs were always high even before the pandemic. So why is healthcare tied to employment? Why? Atul Gawande, one of the foremost national health experts, asked that question. So I think we need to explore the New York Health Act, a single payer system. Dick Gottfried has a bill that's very interesting, which allows us to import prescription drugs from other countries that are cheaper. So I'm looking forward to exploring these bold reimaginings, as well as concrete bills such as the monoclonal antibody bill to save lives.
Thank you. Senator Comrie?
Well, I have a lot of bills, but I'll just talk to two to help seniors. 4178, which would deal with making sure that the utilities are tracking life-saving equipment. With the outages that we had from Isaias last year, where we had a lot of folk that needed to have their life savings equipment given an opportunity to have alternate power, and the Con Ed still hasn't risen up and made that happen. So I want to see that get passed. And also another bill, 4824, which would reimburse customers without having to come up with documentation for any outages that happens over 48 hours. So, you know, if you 2 days without power, you should get a definitive reimbursement without having to go through piles of documentation or receipts, trying to find grocery receipts. A lot of people don't have those things. So we want to try to get it. Those are two of the bills that affect seniors. I have about 90 bills I'm trying to move by the end of the session, as we all are. But, you know, I don't know that we'll get, but those are two that would impact seniors directly, just to be brief.
And Assemblymember Barnwell?
I mentioned the property tax bill for seniors lowering their property taxes, but the other one I will mention is affordable housing bill. As you know, when they calculate what's affordable in New York City, they use a calculation that allows the affordability level to be based on incomes of people in Westchester, Upper West Side, et cetera. So my bill would say, if you're going to build affordable housing, you're going to get a property tax break from the government, from the city or state. You have to use a zip code AMI. So for example, if the average income level in Woodside, where I live, is $60,000, they base the affordable calculation on $60,000 and not $95,000 or $100,000, which is what you see with the current formula. So just base, you get affordable housing project, you want to build, you want to get a tax break, you got to base it on the people who live there, their income, not people up on the Upper West Side and Westchester and other areas.
Senator Addabbo?
Well, I have local bills that would protect Jamaica Bay, help people actually still in Breezy Point, rebuild from Hurricane Sandy, still as a chair of Racing, Gaming, and Wagering, trying to figure out a way to still activate the downstate licenses gaming. But this other bill that I'm very passionate about actually is born out of the COVID pandemic, unfortunately, where I had a constituent who, due to a disorder, was not allowed someone with him in the hospital when he was admitted. And basically, because he could not communicate his medical condition and the medication he was on, he passed away in the hospital. So Senate Bill 1035 just simply allows, during any restrictions, somebody who cannot communicate their medical condition when admitted to a hospital is allowed one caregiver. And I'm really hoping my colleagues could embrace that bill for Fred's sake. It's going to be called Fred's Law. So 1035.
Fred's Law. Assemblymember Cruz?
I want to make sure Norwich, New York, I'm going to keep on pushing it until it gets done. For the folks who are not signed on here, 5781A. I also have a bill that would expand access to local benefits, the municipality type benefits, public benefits for folks regardless of immigration status. Seniors who are undocumented, who may have been undocumented at one point and were able to then regularize their status, have not accumulated enough points, if you will, to be able to retire in a dignified way. And this would allow them access, this would allow everyone, but especially seniors, access to benefits regardless of their immigration status. And one thing that is not legislative, but that it's something I really want to focus on, is trying to get as many seniors vaccinated so we can reopen our senior centers. This isolation is problematic, and I worry a lot about the mental health of our seniors, and I want to make sure we get that addressed.
And Senator Liu?
Get the entire 3 minutes remaining, right? First is we do have senior citizens, pedestrians who are still at risk of getting hit by cars. And so I have a bill that I would like to get passed, and that would lower the blood alcohol content considered to be a DWI from 0.08 down to 0.05. I think it's still a struggle for a lot of different reasons, but this is one of my priority bills that I think it's necessary to make our streets safer for pedestrians, many of whom are senior citizens. And speaking of senior citizens, many seniors have been attacked in New York City and across the country, particularly within the Asian American community, in this incredibly difficult increase or onslaught of anti-Asian hate. A lot of this stems from ignorance and fear. And to really get at the problem here, we need to have better education, specifically Asian American education, or teaching our school kids about the history and the experience of Asian Americans. So I have a bill in the legislature that would require the state education department to start making this coursework and materials available.
And Kevin, you mentioned a few of your legislative priorities, but any quick thoughts as we close out?
My overarching thought is please sign on to our secure choice bill, which again is Assembly 3213, Senate 5395. The pay to delay bill, which keeps cheaper drugs off the market, Senate 4370, Assembly 7245, and our accessory dwelling unit or ADU legislation that we support, which is Senate 4547 and Assembly 4854. I hope everyone on the panel will take a close look at those and sign on.
And of course, I wouldn't make any of you do anything that I wouldn't do. We're going to pretend that we still have a minute or two, and I'm going to race through. First of all, I just want to thank all of you. You've been great. You're all very busy people, and I appreciate you sharing the latest with what's going on in the Capitol and in your own districts. And of course, let's keep the conversation going. Join us tomorrow as we honor the State Labor Power 100 list with keynote remarks from top legislators. I think there might be at least one or two that made the list here. Starting at 5 p.m., registration is free and can be found on our website and in the chat. And then of course, Tuesday, May 18th is our annual Digital New York webinar at 1 p.m. Registration is free and can be found on our website and in the chat. And then of course, our next installment of the AARP sponsored series, the State Legislative Forum focused on the Bronx on Friday, May 21st at 10 a.m. Is it free? You betcha. Registration is free and can be found on our website and in the chat. In lieu of our traditional audience clapping, I'll give you all a little bit of a clap from my apartment out here in Albany. Thanks again so much. Zach Williams, Senior State Politics Reporter at City and State. Thank you all, and thank you to our great audience. Catch you next time.